Hi, it's me, Ingrid INFP, and I'm going to talk about being an autistic doctor. Um, and I don't know if I'm autistic. I'm just self-diagnosed. I haven't been through the assessment, but I have been. Basically, other people have in the healthcare profession said that I probably, definitely have the diagnosis. So, I wanted to talk about some pros and cons for autism. Um, I could make another one about ADHD, but I think that that's probably been done before. Um, I don't know. Um, it seems like I have met more doctors who have ADHD than doctors who have autism, but I don't know. That might just be a very subjective experience. Anyway, um, I think that obviously there are more, I think that there are more autistic people within the doctor population than within some other jobs out there. And the reason for that is because a pro of being a doctor, if you're autistic, is that if medical stuff is your special interest, then like there's infinite possibility of like diving deep into that one specific interest. And medical school is a really long process, and you know, we get you need some stamina if you don't really care too much about the topic. So you need to really like the topic, and that's where if an autistic person has a special interest in medicine, then they will go far, especially if they have a special interest in something very specific. Though it might be difficult to get through the first years where everything is so general, and then you can go and deep into your interest. But you don't need to have a special interest in medicine in order to be a good autistic doctor. You can also just happen to be autistic and be a good doctor. As long as you're willing to put in all of that work and effort. You need to have some kind of interest, but it doesn't need to be a special interest. Anyway, there's that. So I think that a lot of people who are gifted intellectually also end up in medicine as doctors, and there is a correlation between that and autism, particularly if you have low support needs autism. What people used to refer to as Asperger's, which we do not refer to as Asperger's anymore because Asperger's was a Nazi. And also because we went to make the autism label more inclusive rather than less. So there's that. Then we get to the cons, I guess, which is that there's a lot of social interaction and having to be polite and interact with people a lot, with patients. But it doesn't need to be a handicap. It's just that you'll have to do a lot of social interaction in order to be a doctor. But arguably, it's better in my world to be a doctor than to be a nurse or a nursing assistant. Because there's less of that silly small talk, which a lot of autistic people hate. So I would say that it's less of a con compared to some other service jobs that are more like care jobs. As a doctor, you kind of have the possibility of removing yourself a little bit from the situation of the one-on-one conversation. So there's obviously that. A lot of social interaction and communication is actually important for the diagnostics process, but also for the treatment process. And if you have a hard time reading social cues, it will be a difficulty. You will also have to make a lot of phone calls, which is not always an autistic person's forte, I guess. I've gotten much better at it because I can kind of like put on this work persona, and then I hate receiving phone calls. You know, I'm that kind of patient who never picks up the phone, especially if it's like a hidden number, a private number. I will not pick up the phone. But if somebody calls me like 2-3 times, then I will pick it up. I know that I, as a doctor, get frustrated at people doing that, but then I realize like how hypocritical, because I wouldn't pick up the phone either. But so in my private life, I despise phone calls. But in my work life, I've gotten used to it, and I'm okay with doing it because it's kind of like you have a script. There's kind of a certain pattern of things that you have to follow. But, you know, social interaction will never be, autistic people will never be a natural at it. That's all I'm saying. But it can turn out okay, you know. You can learn these social skills. It's kind of a specific kind of skill set because it's concerning this very specific job. So I think that that's manageable, but it is a con, obviously. Now, in terms of sensory wise, a lot of doctor stuff is not very pleasant. But maybe, you know, I don't know what your sensory sensitivities are. It's very individual. It's, you know, some people hate blood and gore and awful smells and all of that kind of thing. But, you know, you don't need to work with that. You know, maybe if you're a surgeon and you don't like the sight of blood, it can lead to some problems, you know. If you don't like bodily fluids, that can be a problem. But it's not as big of a thing in the daily as people like to imagine, you know. What I find is difficult is working at emergencies at the hospital, where there's a constant beeping and the sound of people doing things and people shouting in the corridors and everything. I get to have it a little bit calmer at my workplace, where it's at a small GP clinic. But I know that I would go insane, like thinking about all of the chaos, the noise, the commotion that happens in the big hospital. There will be times where it's quiet and nice, you know, but I think that can be more difficult for an autistic person to deal with than a neurotypical person or allistic person. I think that a lot of people with ADHD might like all of the commotion, I guess, and be very adaptable and flexible. But I think that in general, autistic people don't like the unstructured thing that's going on. And that's good, at least that in medicine this is a pro, is that you can basically choose a specialty, your workplace, much better than some other people. So if you don't like beeping lights and everything, then don't choose a specialty that has a lot of blinking lights. Also, if you are in a service job, it might be difficult for you to have like noise cancelling headphones and all that, because you have to talk to people. So yeah, that's about the sensory stuff. I'm talking about all sorts of different senses. I think that you don't need to be very good at physical stuff to be a doctor. But in certain jobs, it might be important to have like a certain sense of direction, which some people with autism are great at and some people are not great at. I think that a lot of autistic people are surgeons, and can be good at this 3D stuff. I have a hard time with that. I can barely park a car because of that, and so it's difficult for me. So everybody's going to be different, right? That's the proprioception kind of thing. There's another part which is understanding emotions and, you know, that kind of social aspect. That can be difficult if you're in a very social specialty. If you have alexithymia, it can be difficult knowing how to deal with a certain type of patient that is demanding or such. I don't think that stops people from becoming good doctors, but it is definitely something that, well, it can be good to think about before choosing a specialty or something like that. And so we've talked about social-wise and sensory-wise. Now, a lot of autistic people have their stims and repetitive movements, which obviously you cannot do in front of a patient. But I guess that you can do that in the staff room if, if you really need to. But there isn't a lot of downtime in medicine, and I think that a lot of autistic people get burnt out. And so that is definitely a con. To get burnt out is like the worst thing, almost the worst thing that could happen ever, right? But I think that a lot of autistic people are very perfectionistic, and they want to put the 110% of them in, and it's hard as a doctor to not put 100% of yourself in, because you want the best for the patients, you want to do the best job ever. And I think that a lot of people who are not autistic, they understand that they're allowed to not be on 100% always. But I think that a lot of autistic people think that that's the way to become the best, right? But you need to cut yourself some slack, and take care of yourself. And not, do your hours and then go home, especially if you're prone to burnouts. I know that I'm prone to burnouts, I guess, because I got burnt out when I'm pretty young. There is a lot to deal with, a lot of responsibility to deal with, and that can be overwhelming. And it's fun to challenge yourself every day, but it does get to be too much. And doctoring is not a regular 9-to-5 job. I'm trying to make my job kind of more like a 9-to-5 by working in a GP clinic and everything. Some autistic people will never understand the 9-to-5 and will absolutely despise the idea because they work better in the evenings or at night or that kind of thing. For me, it is best for me to work 9-to-5 pretty much, or 8-to-4. 8-to-5 with an hour's lunch. Take your breaks, that's important. I think that a lot of doctors have no breaks, and that is terrible. But especially terrible for autistic people, because we have difficulty with switching tasks and with regulating our systems, and if we don't have a break, then that means basically possibly a meltdown at the end of the day, and after too many meltdowns, maybe a burnout. So definitely a con there, the fact that there's too much work, too much brain power used at all times. So you need to figure out how to get pauses in your work. I found a pretty good job, where I'm not at the end of my line. I can take some time and really reflect and all that, but it's not the norm. Most doctors really work themselves to the bone and then get burnt out. So that's not really great for anybody, right? But especially for autistic people. So yeah, and if you're not even allowed to like regulate through stimming between patients or between work tasks, then you will get burnt out faster. So yeah, there's that, the stimming, there's the repetitiveness. A lot of autistic people like routine, which you can find in a lot of doctor jobs. So I think that that would be a pro of medicine, is that, especially if you're like a surgeon, it's always going to be like if you're a surgeon, you probably just do a certain amount of different kinds of operations, and you do the same specific thing every day. General practice is different things every day, but it is a 9 to 5, which is pretty regular. And you also you have your times for your patients, and then you have your times for other things. And it's very much a regulating process where it's always the same sort of thing happening, especially with experience. And you also meet the same people often, which you wouldn't in a certain more emergency specialties, where it's just like, different things going on all the time. But you can find a certain sameness in everything, because in medicine, your amount of, depending on how much experience you have, at the beginning, it will be a sharp learning curve where you'll have to learn everything from scratch, pretty much. But with time and with support, slowly things will become so automatic that you will be bored, pretty much, of doing the same thing every day. And then, but there are certain specialties where it's always, unexpected, you could say, and not really a routine. So I would not recommend those specialties, for example. But I think that's, in general, I think autistic people can find a certain routine in whatever work they're doing. The most difficult part, I think, for medicine would be the learning part, being a resident, being an intern, because there is kind of like everything is new all the time, and it's pretty exhausting. So I'm getting to a certain point now in my residency that I'm recognizing certain things coming again and again, and it's comforting in a way. So yeah, that could be both a pro and a con, I don't know. Let's think, what are the other things? Well, in medicine, you kind of have a level, less so nowadays, but there is still this level of authority, the status thing that happens, where a lot of patients expect you to have a certain authority over them. Less and less so, because now everybody can go and Google stuff, and the level of respect has disappeared with time and age. But they still expect you to act like a respectable civil servant, And so it's a role that you'll have to play, and you will have to be, to a certain degree, masked. Then how masked you want to be with your other colleagues also depends on the hierarchy. There is a lot of hierarchy in medicine, and I think that a lot of autistic people don't like hierarchy, don't understand hierarchy, don't like having to speak differently with different people. But so that's a con, the hierarchy, and the fact that you have to mask pretty much throughout the day. But maybe if your workplace is a supportive environment, you could find a way to be unmasked. Because you will find that a lot of other people are neurodivergent in healthcare, and maybe your other staff members will want to listen to your rant about some interesting insect or something, you know. Maybe not among the nurses, but among the doctors. Doctors often have some weird interests, you know. At my workplace, there's a doctor who is really into fishing, you know, and it's like that's their weird interest, and so it's not that weird, but it's just that's the thing that they are for. And maybe that person isn't neurodivergent, but I'm just saying that it's not frowned upon to be a little bit eccentric, especially as a doctor, because the nurses just think that doctors are eccentric by nature, and they're just like, oh, it's just because he's a doctor, he's just silly, you know. And so they'll allow for eccentricity. Anyway, so I made all this video. I do want to say that a doctor at my work who is autistic has found my videos, which, you know, kind of weird, but it's because I talk a lot about autism on here. Anyway, so I just want to say hey, and jag förstår inte varför du är på mina videos, men okej. Jag vet inte varför du tittar på just den här, men hej. I mean, I'll be on holiday by the time this video pops out, so I hope that my colleague can check up on my patients while I'm away. And it was a strange experience to find out that somebody in my real life found me in their feed from their algorithm, which is strange because, well, this is kind of my journal, it's my vlog, it's very personal to me, and now somebody in real life has found it. But I don't mind because he's a nice person, and also because that means that my videos are reaching the right demographic of people, right? And it's reaching neurodivergent people. And I don't know if I want other people at my workplace to find my my channel, but just because it's him and because he is neurodivergent, I accept it, okay? I hope he only watched one video, but maybe he's watching this one, who knows? He just happened to see me and he was like, I recognize this person. And I don't know. It wasn't the best video to watch, the one that he watched, but it was the one about autism and obsessions. Which, yeah, showed me in kind of a weird headspace. But I do want to thank everybody who does watch these videos. I hope that these videos help somebody out there. Maybe you're an autistic person who is wondering if they should become a doctor, or you're an autistic doctor, or you're not autistic at all and you're not a doctor at all and you're just here on my channel because you're one of those loyal fans that I have, or because you're just somebody who wanted to click on a video about this very niche topic. But yeah, so thank you everybody, bye.